and we actually have an equipment called the morcellator, which actually churns up the fibroids. It breaks it down into small little bits. We put these all inside a plastic bag, and this is called an in-bag morcellation, and then we take out the bag along with the fibroids outside, so that the fibroid is we are not able to, we won't damage the, we won't make the fibroid spill out and disturb, and it sometimes when it spills out you get fibroids growing all over. That is called parasitic fibroid. So we are very careful when we remove the fibroids. Then we have to suture this place where the fibroids were taken out from, and this we do through the 3D laparoscopy, which is the best form of technology to actually suture, because if you suture very nicely fiber to fiber and in the same plane, then you are able to reconstruct the uterus to what it was before the fibroids came in. That is, it becomes a normal uterus. So then next question, how long do you think we have to wait until you try for another pregnancy? If you check the patency of the tubes at that time and you find the tubes are open, the ovaries are working well, and the fibroids are all removed, then the time needed is about 3 months. By this time the uterus heals and then they're ready for a baby. If everything is good, they can even try for a normal pregnancy. But there is one important warning sign. Fibroids can keep coming again and again, particularly when there are lots of fibroids. So you should not give a very big gap. 2 to 3 months is the maximum gap that you can give, and after that you should keep on trying as early as possible for a pregnancy, so that the fibroids don't come back fast. And once the natural pregnancy doesn't happen, then early 1-2 attempts of natural, then you move on to IUI, and 3 attempts of IUI. By the time little fibroids will be coming in, so quickly after 3 attempts of IUI, then if you still don't get a pregnancy, then you move on to IVF, because maybe the tubes are stuck because of the surgery, and therefore you should not give too long a time for this. So when you manage the fibroids effectively, then it really helps to improve pregnancy rates. So fibroids are not something which you need to get scared of. If you handle it effectively, you can do it. Many patients ask me a question, why do you suggest surgery for fibroids? Is there no medical treatment? Yes, medical treatments is also there. We use it mostly when a patient has completed her family and they want to control bleeding. If we give it before they get pregnant, then sometimes the blood flow to the fibroids is disturbed. That means overall the blood flow to the uterus is a little disturbed and pregnancy rates are a little lesser. So generally we try to remove fibroids, or sometimes when fibroids keep coming back, you cannot keep on doing surgeries. So we use an injection which actually decreases the size of the fibroid temporarily, and then we get the patient pregnant, and once she's delivered, then till the pregnancy is achieved, we give the Zoladex, and then we stop the Zoladex, and by this time the patient is pregnant, so our problem is solved. Now, like the fibroids, there is another problem which happens in the uterus, which is called adenomyosis. Adenomyosis is a collection of small circles of period blood in the muscle of the uterus. So when this happens, then every time the patient gets a period, the size of the uterus keeps on increasing, and the more the adenomyosis, the more it irritates the uterus, and then the patient finds it very difficult to get pregnant, because the minute the baby is inside the uterus, there are small irritability caused by the adenomyosis, and the embryos don't fix well and it just goes away. So getting pregnant in an adenomyotic uterus which is very big is difficult. So if it is small, then maximum we try medical treatment. We give injections to reduce the size of the uterus, and then after that we try for the pregnancy. But sometimes the adenomyosis is so big, 14 centimeters, 20 centimeters, so in that case it does not respond to medical treatment, and therefore we use the laparoscope to take off as much of adenomyosis as possible. Then we suture the uterus like we did for a fibroid, and then after that you try for a pregnancy. Now once again here you should remember that the time gap to get pregnant is about 2 to 3 months. You should not wait too long, you should not do it too early, because you have to wait for the uterus to heal. And if you wait too long, adenomyosis, like I told you, is a collection of period blood, so the period blood will keep on collecting. So try to get pregnant as early as possible, and if at all it doesn't work, then better to go for IVF, because if you were, like I told you, if you wait for too long, the adenomyosis increases.